We are fortunate to present an abstract at this ASH looking at the response of MPN patients to COVID vaccinations. And so what we did for this study is collect samples prospectively from my clinic before they received their COVID vaccination, and then again a month after they received their last vaccination. Patients primarily received the Moderna or the Pfizer vaccine. We did not have any J&J participants. And patients were included across the spectrum of MPN diagnosis, including essential thrombocythemia, polycythemia vera, myelofibrosis, and we also included chronic myeloid leukemia patients. We were really interested in this study because, we recommend vaccination to our patients in general, but we really don't know that much about the efficacy of vaccination for patients with leukemias in general and myeloproliferative neoplasm patients in particular. And we were very excited to see that patients with MPN actually really did have excellent responses to vaccination. Our study is unique in that we did not only measure response to vaccination by measuring serologic response, we also measured T-cell responses to vaccination, as we know that the immune response is not as simple as do you have antibodies or not, but it's important to understand the role of the T-cells in the immune response. And so overall, patients with ET and PV and CML had pretty normal responses compared to the general population. And we actually also tested responses in a group of healthy controls. And so the responses in general were great in those groups of patients. Patients that have myelofibrosis and that are on ruxolitinib specifically do have antibody responses and do have T-cell responses, but they do seem to be blended compared to the other MPN patients and to healthy controls. And so I think that's something worth studying a little bit further. Do we need to recommend different strategies of vaccination for some of our more immunocompromised patients?